Today we will be presenting about gonorrhea in the United States. Gonorrhea is a sexually transmitted illness that is caused by the bacterium Neisseria gonorrhea. It is transmitted easily through the bacteria infecting the mucosa of primarily the urogenital tract, rectum, pharynx, and the conjunctivae. It is a very prevalent STI globally, but especially in the US. There are both symptomatic and asymptomatic aspects of the disease, with the symptomatic aspects occurring most commonly in people with penises.
Into gonorrhea, both men and women will experience pain during urination, but men will experience a pus discharge at their penis and swelling and pain in their testicles. But women will experience unusual vaginal bleeding, increased discharge, and/or pelvic and abdominal pain. Contrary to popular belief, gonorrhea does not only affect one's genitals, but it can also affect the rectum, eyes, joints, and throat. Going into some misconceptions, gonorrhea does not only affect an individual's future. This is false because gonorrhea can lead to complications and infertility. Gonorrhea only affects the genitals. As said before, severe gonorrhea can lead to fevers, rashes, skin sores, and swelling, and women who develop gonorrhea most of the time know. This is false because most women with gonorrhea are asymptomatic and leave it untreated.
Next, I will give you a general overview of the epidemiology of gonorrhea in the U.S. It is the second most commonly reported STI to the Centers of Disease Control and Prevention. As of 2019, the CDC estimated the number of new infections that occur annually in the U.S. is 700,000. The age group with the highest incident rate of infection in the U.S. is 15 to 24-year-olds. Marginalized groups are disproportionately impacted by gonorrhea in the U.S. For men who have sex with men in the U.S., the STD Surveillance Network collected data in 2017 that showed that 26.5% of infections in participating jurisdictions were in MSM. For transgender people, data is scarce, but for trans women, there was a 2.8 positivity rate among 406 STI clinic attendees in many sites in the U.S. For trans men, among 105 transgender men at STI clinics in the U.S., there was a 7.1% urogenital positivity rate.
Racial and ethnic minorities. In 2017, the reported rate of gonorrhea cases among Black people was 8.3 times the rate among whites, 548.1 per 100,000 among Black people, and 66.4 per 100,000 among white people. High rates were observed in Black women and men aged 20 to 24, 2,066.8 per 100,000 and 2,154.8 per 100,000, respectively. In 2017, the reported rate of gonorrhea cases for Hispanic people was 1.7 times the rate for white people, 113.7 per 100,000. On Indigenous people in 2017, the reported rate of gonorrhea cases among American Indians/Alaska Natives was about 5 times the rate for white people. The women in this category from 20 to 24 years old was a rate of 1,037.7 per 100,000. The risk factors for gonorrhea are being HIV positive, engaging in risky sexual behaviors, sexual violence, substance abuse, inaccessibility to condoms, system inequalities, and health disparities also contribute to poor health outcomes and the observed disparities in gonorrhea rates.
Popular control measures are safe sex counseling, appropriate diagnostics, and antimicrobial therapy. As for state level policies, expedited partner therapy, EPT, is used as a way to reduce gonorrhea infections by relying on the patient to deliver treatment to partners. For the CDC guidelines, consistent and correct use of latex condoms during intercourse can reduce the risk of transmission, as well as taking abstinence or being in a closed monogamous sexual relationship with a partner that is not known to be infected.
Unfortunately, due to gonorrhea's antibacterial resistance and frequent mutations to all microbiomes, it has become resistant, and 3 new approaches have been developed to try to treat it. Additionally, there are many information and care centers whose services to provide accessible information or health resources. They are open to anyone who needs this type of information for gonorrhea.